here, and today's a pretty light day because I've decided like, okay, do I want to do both lecture on joints and muscle tissue? Now, muscle tissue, I got warn you in advance, it is can get kind of gnarly. So I was like, okay, let's just make it a light day. It's Wednesday, it's hump day, everyone's kind of like trying to get through the week, so today's lecture will be pretty short. Okay, so then today is like my favorite part of, I mean, not only do I like the whole chapter on joints, but I think joint movements are really fun. I wish we were in person. Like, this is always one of the most fun lectures, but unfortunately, we have to deal with the whole COVID stuff anyway. All right, so what do we see here? Like, this is a tough thing with joint movements and why often it's best taught in person and in video because, I mean, look at this picture right here. It looks pretty like, I mean, there's a lot going on in this picture, and I think that's what one of the disadvantages of how I think actually OpenStax kind of wins this one a bit because it breaks it down. But yeah, the Martini, there's a lot. She's like doing this weird version of the shoot or something. But with law Martini figures, it's hard at first, but if we break it down, it becomes a lot, makes a lot more sense. Okay, so flexion and extension. I think this is why a lot of people have a tough time initially with this joint movement section, is that they get confused with flexion and extension. Now, this is how I started learning it, and I think this is where you should start. So start from anatomical position. Again, when you're standing up, your hands are to your side, and actually like palms facing forward. And oh, actually, I don't think I mentioned this during the appendicular skeleton. Like, like when you're standing up, usually your arms are straight down to the side, right? But why is it open up and supinated like this in anatomical position? Well, think about the radius and ulna. Notice that in anatomical position, they're uncrossed. But if you start twisting it this way and letting it hang naturally, well, notice that the radius is starting to obscure the view of the ulna. So that's another reason why anatomical position is in the way it is. At least that's what I was taught. That anatomical position is with the palms facing forward because it uncrosses the radius and ulna. So again, you have to know what an anatomical position is first. Again, that standing position. Now flexion, this is the book's definition, the more of the kinesiology, physiology, and anatomy definition. So it does involve geometry. So something that decreases the angle of a joint. So I will break you down. I will kind of help you to visualize this angle, but again, some people think like geometry, I'm out. But if you draw this imaginary line, it becomes a lot easier to view, in my opinion. And then this is a common misconception. Being flexible is not the same thing as flexion. So again, just because someone's showing a lot of flexibility in a joint does not mean they're necessarily doing a movement of flexion. Flexion refers to the direction and angle of a movement. Flexibility is not the same thing as flexion. And also, flexing your muscles is not necessarily flexion. So people, when you think flex, you think flexing a muscle, contracting skeletal muscle. Well, flexion is not the same thing as flexing and contracting a muscle. So again, flexion refers to a change in angle and direction. Now again, and then you can, so this is my kind of rule of thumb. So basically, when you're starting with anatomical position, if you're moving some body part toward the anterior, that's most of the cases is flexion. So things like your knee. Well, of course, your knee doesn't bend forward, right? So, or it doesn't bend forward to extreme angle. So in general, the knee, ankles and toes are different because again, in anatomical position, when you're standing, your feet are planted on the ground, so your toes can't really curl toward the front because they're already pointing toward the front. Same with the ankles. Your foot is already pointing toward your anterior. That's why there are kind of exceptions, but definitely the knee, that does not flex forward doesn't flex forward to an extreme degree in natural conditions. Then extension. So the book definition I have here on top, so it's the movement in the sagittal plane that increases the angle of the joint. So basically it straightens out the joint. Now, this is like the opposite of my rule of thumb, and this is why I put a little asterisk there. Again, do not carry this definition to your kinesiology or PT classes. This is like when you're starting out, this is how you can identify flexion. Opposite is kind of true for extension. If it's toward the back or posterior, then in general, that's extension. except knees, ankles, and toes. So basically, flexion and extension, they're antonyms, they're opposite directions. Just like superior is the opposite of interior, lateral is the opposite of medial, flexion is the opposite of extension. So when you have flexion in one direction, just by moving in the opposite direction, you're doing extension. So again, flexion, most cases toward the anterior, except these three, knees, ankles, and toes. So extension undoes flexion, and it's a little preview for when we talk about muscles. So whenever there's some sort of movement or action, there are always a group of muscles that undoes that same sort of movement. So muscles don't just move in one direction. So there's always moving muscles. If you move, some muscles move something in one direction, there's something that undoes that same movement. Now this is a common misconception, just like how muscle flexing isn't the same thing as flexion. Stretching, when you think of extending, you're thinking of like, okay, you're stretching out, extending all your body parts. Well, stretching does not necessarily mean extension. So again, when we talk about flexion and extension in terms of joint movements, we're not talking about the everyday use of flexing and extending. We're talking about this angle between joints. Right, so again, do not carry these definitions that I have asterisks to your future classes. This is like when you're starting out, and then you can build upon it once you start to recognize angles between joints. All right, so again, flexion, movement towards the anterior, except the knee. I can't underscore that enough. And extension, movement toward the posterior. Now, hyperextension is when you're doing an extension movement, but then you go past the anatomical position. So when you look at someone in an anatomical position from the side, they're just straight up it. They're pretty much aligned, unless they have like scoliosis or kyphosis. They're pretty much straight vertical, right? But once you go past that vertical line while you're doing an extension, that's hyperextension. So you're going above. You're like being very extra with the extension. Okay, so here's angular movement. So this is how now if you don't get this, then this is just how I identify whether a movement is flexion or extension. If you have a better way, or if somebody taught another way, by all means go with that definition. But when I'm looking at a joint movement, I'm like, okay, is this flexion or extension? This is what I do first. So first I locate the joint, and this is often what is tricky when answering these sort of questions on exams or any sort of question exams. Like first, if the joint isn't really pointed out, it's kind of like hard to answer the question. So you want to know what joint you're talking about. In this case, we're talking about the wrist joint right here. Now what I do is draw a line, imaginary line through that joint that aligns with the anatomical position. So say these aren't in anatomical position, but say the hand was in anatomical position with the forearm. What would that line look like? It would look something like this, because again, in anatomical position, the hands are relaxed, the palms are facing forward. So if this was in anatomical position, the hand would be aligned here. But of course, in this picture, they're not showing the hand aligned with anatomical position. So again, this is like a straight 180 right here. So does the movement increase or decrease the angle at the joint? So what we see here is that this hand is moving from this position, and now it's in this position. So now you see that this angle is less than 180. So this is flexion according to that very strict textbook definition. But at the same time, if this person was facing, like say you saw the rest of this person's body, their palms would be facing forward. So notice that this wrist flexion is a movement toward the anterior. So again, that's my general rule of thumb. Doesn't apply to every single type of joint movement, but again, if it's generally toward the anterior, most of the times it's flexion. So it kind of reinforces that. So that is flexion because again, it's decreasing the angle, and using my very general rule of thumb is going toward the anterior. Now remember, the opposite of flexion is extension. So even you can still be doing extension if you're starting in this position, but you're going to anatomical position, that would still be extension. So you can still be doing extending if you're traveling this direction. So again, extension just meaning a general direction. But if you go past that imaginary anatomical position line, then you're in hyperextension. So again, you have extension, but once you go past here, this wrist is now hyperextended. So it went past anatomical position. It's still extending, and notice that it went from 180 and a greater than 180 angle between the forearm and the wrist. So again, past anatomical position is hyperextension. And oh, this always comes up every year. Is there such thing as hyperflexion? Yes, I don't think your book really goes into detail with it, but I think it's like when you think of hyperflexion, it's more like you have flexion, but it's like, say I was able to touch my wrist all the way, or the palm all the way to my this part of my wrist. Yeah, if I was able to like flex this all the way with no angle, that would be hyperflexion. That would be pathological. I'd probably break up a few things along the way. So there is hyperflexion, but don't worry too much about that for this class.